speaker, and it's a privilege to follow that very powerful maiden speech. I'm certain you will do your constituents proud, as you did in your time serving in our armed forces. I welcome this debate. After 14 years of Conservative government, our health service is in a critical condition. And in my constituency, it takes just about 10 minutes to drive from the centre of Hatfield to Welwyn East. But the difference in life expectancy is now 10 years.
Shame.
Responsibility for the crisis sits not with our wonderful healthcare professionals, but squarely with the last Conservative government. I've spent as much time as I can with our NHS heroes, and I recently saw the professionalism of our paramedics firsthand after joining a shift with Daisy and Jake in the East of England ambulance service. They were a credit to their badge, and I'm pleased to say that I got through blue lights okay. But look, GPs are battling a backlog. In my constituency of Welwyn Hatfield, more than 2,000 people waiting more than a month for a local appointment. Dentists are withdrawing from the NHS, including in Pear Tree Ward in Welwyn Garden City in my constituency. And the most vulnerable are invariably the most seriously impacted. As the Darcy report made clear, people experiencing homelessness attend A&E 4 times as often as the general population and are 8 times more likely to need inpatient care, all immense costs to them and to the overall NHS budget. We will only rescue our health service if we reform primary care, and that's why today's debate is so important. Despite rising demand, there were 5% fewer nurses working in the community in September 2023 than there were in September 2009. And the NHS Confederation is clear. Spending in primary and community settings has a superior return on investment when compared with acute hospital services. Darcy was clear. It makes sense, therefore, that there should be a fundamental strategic shift to the community. Innovative work is out there. Again, in my constituency, I've seen the hospital at home service run by the East and North Herts NHS Trust that serves people. It's particularly powerful for those who are over 80, who need rehabilitation and care, but actually hospital is not the best place for them. Their homes are. So when the Shadow Minister said earlier she wasn't expecting to hear some new ideas, they are out there, but it's the job of our government to embrace them and to take it forward. I have every confidence that this Labour government will do that. From the party that founded the National Health Service, one that has a clear vision for the future, from analogue to digital, from hospital to communities, and from sickness to prevention.